Hey there, and welcome to the Deep Dive. Today, we're tackling a topic that, well, it sounds simple, just inflammation of the feet in dogs and cats.
Right. Pododermatitis.
But as our source material shows, it's anything but simple. It's actually pretty complex.
That's exactly right. We're pulling insights today from excerpts of a text called Canine and Feline Pododermatitis, Causes and Treatment. So, really focused stuff.
And our mission here is to take this, quite detailed source material and really distill it for you. We want to understand what pododermatitis actually is, what kinds of things cause it, and the list is surprisingly long. How vets go about diagnosing it, and crucially, how it's managed. Think of this as your guide to the key takeaways from this text.
Getting right to the core information.
Okay, let's unpack this.
So, starting right at the basics, the definition. Our source describes pododermatitis not as a single disease, but as an inflammatory, multifaceted complex of diseases.
A complex. Okay, so it's more like a symptom, really. A reaction happening in the feet.
Exactly. It's a sign that something else is going on. And the source really hammers home that the underlying cause is what determines everything else there. Pathophysiology, how it develops.
Right, and it lists these main categories of causes. We've got infections,
Bacterial, fungal, parasitic.
allergies, immune system problems. The source calls them autoimmune dermatosis.
Then there are endocrine or metabolic diseases like hormone issues.
Cancer, unfortunately, is on the list too, neoplasia, and environmental factors.
Things like irritants. Yeah. And even though it's noted as rare, psychogenic causes like stress or behavioral issues.
Wow, okay, that's a broad range. And the source mentions this mainly affects the skin and related systems in the feet.
Skin and exocrine systems, yes. And a really key point the text makes early on, this is common in dogs. Like, really quite common.
But not so much in cats.
No, the source explicitly states it's considered uncommon in cats. Big difference there.
Interesting. Okay, so who tends to get this? Let's talk signalment. Obviously, dogs and cats.
Right. And for dogs, the source does point out some breed predispositions. Seems short-coated breeds pop up most often.
Like which ones?
Let's see. English Bulldogs, Great Danes, Bassets, Mastiffs, Boxers. Quite a few popular breeds listed.
No, there's not just them, right?
No, definitely not. The source also lists affected long-coated breeds. German Shepherds, Labs, Goldens, Irish Setters, even Pekingese. So it's widespread.
But for cats, the source basically says no specific breeds mentioned.
Correct. No specific breed predilections noted for cats in this text.
What about age?
Any age, really, but the source does give some pointers. In younger dogs, you might lean towards thinking about hypersensitivity, so allergies.
Or maybe mites.
Dermatitis.
Exactly. Demodex, infections, those interdigital follicular cysts we'll talk more about later, or even autoimmune issues starting young.
And in older dogs.
Well, in older dogs, the possibilities expand. You still have all those potential causes, but you also have to consider neoplasia cancer or other systemic diseases more seriously.
Got it. And the source mentioned it's maybe more common in male dogs. Yes, a predominant sex noted for dogs, males. But again, nothing mentioned for cats on that front.
Okay, now let's get into what this actually looks like.
Right, the signs. And here's where it gets really interesting. Because, as the source emphasizes repeatedly, the history you get and the physical findings can vary hugely.
Because it all depends on that underlying cause we keep mentioning.
Precisely. So getting a thorough history is absolutely vital. The source suggests asking about, well, everything.
Like their environment. Indoor, outdoor, working dog, pet dog.
What surfaces they walk on. Are there unsanitary conditions? Any other pets affected?
Trauma history, any potential contact irritants, even things like hookworms.
Yeah, and the age it started. Is it seasonal? That could point strongly to atopy environmental allergies.
Or maybe contact allergies if it happens after they walk somewhere specific.
Right. And where are the lesions? Just the feet? Other parts of the body, too? All four paws or just one? The whole foot or specific areas like between the toes or around the nails?
And critically, what's been tried before? Did anything help? Antibiotics, steroids, antifungals, even if it was just temporary relief, that's useful info.
Absolutely. Diet history, travel history, other medical problems, it all builds the picture.
Okay, so that's the history. Now, the physical exam findings. The source breaks this down nicely by the type of cause. Let's start with infections in dogs.
Okay, for infectious causes in dogs, you're often looking at classic inflammation signs. Redness, swelling, maybe nodules or raised, firm areas the source calls inflammatory plaques.
Like fungal carrions.
Yes, those are mentioned. You might also see ulcers, fistulae, those draining tracts, or even like blood-filled blisters, hemorrhagic bullae.
And discharge.
Definitely. Serosanguineous, that's watery and bloody, or seropurulent, which is more like pus. The feet can look really swollen, sometimes with pitting edema, especially around the metacarpal and metatarsal areas.
So the main wrist ankle bones of the paw.
Right. The skin might be bald, alopecic, and damp from constant licking. Pain and itchiness, pruritus, are common, and that inflammation around the nail folds, paronychia, is also often seen.
And maybe swollen lymph nodes nearby.
Can happen, yes. Regional lymph nodes might be enlarged.
What about infections in cats? The source said pododermatitis is less common, but what does it look like when it is infectious?
In cats, the source highlights painful paronychia, often involving just one or more claws. And cats seem to have a higher incidence of distinct nodular lesions that are often ulcerated compared to dogs.
Okay, so more lumpy and broken open.
Kinda, yeah. And the focus tends to be on the foot pads and the periungual areas right around the nails. The interdigital spaces between the toes are less commonly affected in cats, according to this text. Sometimes you just see scaly, crusty lesions, too.
Okay, moving on to allergic causes. What does this look like in dogs?
Well, the main driver is itching, so you'll often see redness, erythema, and hair loss, which could be on the top or bottom surfaces or both.
From all the licking and chewing.
Exactly, which often leads to that reddish-brown salivary staining on the fur. And while the source says allergic contact dermatitis isn't super common, when it does happen, the inflammation is usually worse on the bottom, the ventral interdigital surfaces.
Makes sense, that's the part touching the allergen. And allergic cats.
For cats, the source describes single or multiple plaques, raised areas that are itchy and can be exudative, meaning oozing or ulcerated. These tend to show up on the digits, around the nails, and between the toes.
And it links these to eosinophilic granuloma complex lesions.
Yes, that specific type of inflammatory reaction common in cats.
What about immune-mediated problems when the body's attacking itself?
In dogs, the source says crusts and ulcerations are the most common signs you'll see. Sometimes vesicles or bullae blisters. It often affects all 4 feet, especially the nail beds and the foot pads.
And it mentions something specific about pemphigus foliaceus.
Right. Hyperkeratotic, meaning thickened and erosive dermatitis, particularly along the margins of the foot pads, is described as a common finding in that specific disease.
And immune issues in cats.
In cats, the source notes lesions generally involve the foot pad itself again, thickening, hyperkeratosis, and ulceration. Lameness is common, along with paronychia, that nail fold inflammation, often with exudate.
And plasma cell pododermatitis is mentioned here too.
It is, yes.
Yeah.
Characterized by those puffy, sometimes purplish pillow paws. It gets mentioned under immune-mediated and also later under miscellaneous, highlighting it's a bit unique.
Okay, endocrine or metabolic causes.
Yeah.
Like hormone problems.
In dogs, the lesions often just look like secondary infections because the underlying condition compromises the skin's defenses. But the source highlights a specific, though rare, condition, hepatocutaneous syndrome.
That sounds serious.
It is, also called superficial necrolytic dermatitis. It causes really characteristic foot pad lesions, severe hyperkeratosis with crusts sticking to it, fissures or cracks, and ulceration.
And the interesting part.
The skin disease, especially those foot pad changes, usually shows up before the pet seems sick from the underlying liver or pancreatic disease.
Wow, good to know. What about endocrine issues in cats? Source said they're rare.
Very rare in terms of pododermatitis, but it does mention cutaneous anthymatoses, which can be linked to diabetes. These look like whitish nodules, kind of like candle wax strips.
Okay. Next category, neoplasia or cancer.
In dogs, this can present in various ways. Nodules, which might be ulcerated or not, scaling, redness, even loss of pigment on the foot pads. Sometimes it's just one digit involved.
Like a nail bed tumor.
Exactly, like squamous cell carcinoma of the nail bed or an ungual keratoacanthoma. But other types, like epitheliotropic lymphoma, can affect multiple feet. Itchiness is variable with cancer.
And the source noted cancer affecting the feet is actually more common in cats than dogs.
Yes, that's a key point highlighted. In cats, you typically see nodules, often ulcerated and painful. Tissue destruction varies depending on the tumor type.
And it can be primary or metastatic.
Right. Some tumors start in the foot pad, others are cancers that have spread, most notably metastatic carcinoma from the lung, which surprisingly often shows up first in the cat's digits.
That's unexpected. Okay, environmental causes. Seems more straightforward.
It depends on the specific cause, of course. Could be just one digit or foot affected if it's, say, a foreign body like a thorn or grass on or trauma.
Or it could be multiple feet.
Yes, if it's due to something like irritant contact dermatitis from walking on treated lawns, or thallium toxicity, or even just housing on rough concrete or constantly wet surfaces.
And what does that look like?
Often chronic inflammation between the toes, maybe ulcers, sometimes those pyogranulomatous abscesses or draining tracts we mentioned earlier, swelling. It might be itchy or it might not be.
Okay, almost there. Miscellaneous causes. What falls under here?
For dogs, the source lists general hyperkeratosis of the foot pads, sometimes linked to nutritional issues like zinc deficiency or even certain generic dog foods, and also idiopathic digital hyperkeratosis thickening for no known reason.
And those cysts.
Ah, yes, interdigital follicular cysts. Big topic. These typically present as nodules, often with fistulae or draining tracts, usually on the top surface between the toes, especially on the front feet.
And they tend to recur.
Yes, history of recurrence, poor response to just antibiotics. And the source notes you often see associated skin changes on the bottom surface, like thickened, bald skin with comedones, blackheads.
Anything else miscellaneous for dogs?
Other nodules without draining tracts could be sterile pyogranuloma, seen in several breeds, or nodular dermatofibrosis, particularly noted in German Shepherds and Goldens.
And a really tough one.
Acral mutilation and analgesia, seen in specific pointer and spaniel breeds. They basically chew their feet raw, seem to lack normal pain sensation, cause unknown, no real treatment, and the source sadly notes euthanasia is common.
That's rough. Miscellaneous for cats.
Things like changes in foot pad color, hypomelanosis, loss of pigment like vitiligo, or hypermelanosis, more pigment like lentigo, and plasma cell pododermatitis gets another mention here too.
Okay, so we've covered what it looks like in detail. Now let's circle back and quickly list the specific causes within those categories the source mentioned.
Sure. So under infectious...
For dogs, bacteria like staph, Pseudomonas, Proteus, even Mycobacterium or Nocardia, fungi like ringworm, or deeper stuff like blasto or crypto, parasites like Demodex mites, Pelodera, hookworms, and even protozoa like Leishmania.
A long list. For cats, similar bacteria plus Pastorella, similar fungi, though blastomycosis is excluded, different parasites like specific mites, Neutramicula, Notoedares, Demodex cati, and a protozoan called Anatrachosoma cutaneum.
Allergic causes for dogs.
Mostly atopy, environmental allergies, and food hypersensitivity. Allergic contact dermatitis is listed, but noted as uncommon.
And cats.
And atopy is listed. But the source says it's rare for flea allergy, food allergy, or contact allergy to primarily affect the paws, unless it's presenting as those eosinophilic granuloma complex lesions.
Immune-mediated, big category.
So dogs, pemphigus foliaceus, lupus, SLE, erythema multiforme, cold agglutinin disease, a whole bunch of complex ones like pemphigus vulgaris, bullous pemphigoid. The list is long. Symmetrical lupoid dystrophy affects the claws.
And cats have their own list.
Yep. Pemphigus foliaceus, SLE, erythema multiforme, vasculitis, cold agglutinin disease, and plasma cell pododermatitis pops up again.
Endocrine metabolic causes in dogs.
Hypothyroidism, hyperadrenocorticism, Cushing's, and that rare hepatocutaneous syndrome.
Cats.
Hyperthyroidism, hyperadrenocorticism, the diabetes-related xanthomatosis. But again, the source stresses endocrine pododermatitis is rare overall in cats.
Neoplastic causes the cancers.
Dogs, squamous cell carcinoma, epitheliotropic lymphoma, melanoma, mast cell tumor, keratoacanthoma, others.
Cats, where it's more common. Papilloma, various carcinomas and sarcomas, trichoepithelioma, fibrosarcoma, and importantly, metastatic lung cancer or other spread cancers. Environmental causes recap.
Dogs, irritant contact, trauma, rough surfaces like concrete, too much exercise, clipper burn, foreign bodies, grass awns are classic, even bristle-like hairs from short-coated dogs getting embedded. Thallium toxicity, too.
Bats, similar irritant contact, foreign bodies, thallium toxicity.
And miscellaneous recap. Dogs have sterile interdigital granulomas, those follicular cysts. Cats have the pigment changes and plasma cell pododermatitis, and the acral mutilation in dogs fits here, too.
Got it. The source also briefly touches on risk factors, right? Beyond just breed.
Yeah, it mentions lifestyle and general husbandry. Things that might predispose or just make it worse include excess exercise on hard ground, abrasive, or constantly damp housing conditions.
Poor grooming. Lack of basic vet care.
Exactly. And it circles back to, say, body size, foot conformation, just the physical shape of their paws and breed can influence the development of specific issues like those interdigital follicular cysts.
Okay, so with this massive list of possibilities,
Yeah.
diagnosis. How do vets actually figure out which one it is?
Well, the source says the differential diagnosis, that list of possibilities, is built by considering all those signs and potential causes we just spent time on.
Makes sense. Start broad. What about basic lab work?
Routine blood counts, chemistry panels, urinalysis. They're rarely diagnostic for the foot problem itself, but they might pick up an underlying systemic disease that's contributing.
Right, like finding evidence of Cushing's or diabetes.
Exactly. Other lab tests really depend on what you suspect. Hormone assays for endocrine disease, maybe serology or immune studies if you're leaning towards infectious or immune-mediated causes. Imaging, too, depends on the suspicion X-rays for foreign bodies or bone issues.
What about procedures specific to the skin?
Key ones listed are skin scrapings or hair plucks, essential for ruling out mites like Demodex, fungal cultures for suspected ringworm or other fungi.
Looking at discharge under the microscope.
Definitely. Cytology, examining smears of exudate or pus from pustules, can quickly identify bacteria or yeast, guiding initial treatment while waiting for culture.
And culture and sensitivity testing.
Crucial, especially for bacterial infections that aren't responding or seem deep. The source says to culture exudates or even biopsy tissues to know which bacteria are present and which antibiotics will actually kill them.
Speaking of biopsies, when does the source say those are needed?
In dogs, it's indicated if those initial skin scrapings are negative, but you're seeing more serious lesions like nodules or draining tracts. Taking samples from the bottom surface, especially near draining tracts, is highlighted as potentially useful for diagnosing follicular cysts and the associated inflammation pattern.
And for cats, the source suggested maybe more often.
Yes, because pododermatosis foot skin disease is relatively rare in cats, the source suggests biopsies might be indicated in, well, perhaps all cases, or at least more readily considered. The concern for something more serious like cancer or a specific immune disease is higher.
Okay, and other specific tests.
Mentioned are restricted ingredient food trials for suspected food hypersensitivity, intradermal testing or blood allergy testing for atopy, and those specific endocrine assays for thyroid, adrenal, or diabetic conditions.
And the biopsy results, the pathology findings.
They depend entirely on the underlying cause, showing the specific cellular patterns of inflammation, infection, immune reaction, or cancer.
Okay, so diagnosis is a process. Let's talk treatment and prognosis. How is this managed?
Mostly outpatient, unless surgery is needed. Basic nursing care like foot soaking, hot packing, or bandaging might be helpful, but it depends on the specific cause.
Activity level might need adjusting.
Yes, based on pain and severity. Diet change is key if a food trial is indicated.
And client education sounds critical here.
Hugely important. The source emphasizes discussing husbandry, preventive care, and managing expectations. It specifically points out that allergic, immune-mediated, or endocrine causes can usually only be managed, not cured. That's a vital conversation.
What about surgery?
It has its place. For aggressive tumors like melanoma or squamous cell carcinoma, amputation of digits or even the paw might be needed, hence the need for early diagnosis. Surgical debridement, cleaning out dead tissue, can help in severe infectious cases before starting meds.
And for those recurring cysts?
Laser ablation is mentioned as an option for recurrent draining tracts from interdigital follicular cysts.
Medications seem like they'd be very cause-specific.
Absolutely. Antibiotics, often long courses like 4 or 6 weeks minimum based on culture results. Antifungals if needed. Anti-inflammatory or immunosuppressive drugs like corticosteroids are common.
Other possibilities.
More targeted immunomodulatory meds, chemotherapy for cancer, hormone replacement for endocrine issues, maybe zinc supplementation, or even intravenous amino acids for that rare hepatocutaneous syndrome. It's a wide pharmacopoeia depending on the diagnosis.
And precautions. Monitoring.
All depend on the specific treatment protocol being used. Monitoring frequency and type varies greatly.
Prevention seems tricky if it's allergy or immune-mediated.
It is. For environmental causes, good husbandry helps. For allergies, strict food avoidance or possibly immunotherapy for atopy are the mainstays. Otherwise, prevention often isn't possible. It's about management.
Complications.
Again, depends on the cause and the treatment. Could be side effects from meds, recurrence of infection, progression of cancer.
So the expected course and prognosis. What's the bottom line from the source?
Success hinges entirely on finding that underlying cause. And the source is frank. Often the cause remains unknown, or even when it is known, management can be frustrating.
Due to relapses or maybe cost of long-term treatment?
Both. Relapses are common, and some therapies can be expensive or have side effects. The recurring theme is that often this disease can only be managed, not cured.
And referral to a specialist might be needed.
Yes, the source suggests referral, often to a veterinary dermatologist, can be really beneficial for these complicated or stubborn cases.
Okay, so what does this all mean?
I think the biggest takeaway from digging into the source material is just how complex pododermatitis is. It really drives home that it's rarely just a sore paw.
Yeah, the range of causes, infection, allergy, immune, endocrine, cancer, environment, it's huge.
Huh?
It leads to such different signs and requires such different approaches.
Exactly, and the source makes it crystal clear. Identifying that specific underlying cause is the absolute key, the bottleneck for effective treatment. But
Right.
doing that, it's often a real diagnostic challenge.
Requiring multiple tests, maybe specialist input.
Mm-hmm. And what's fascinating here, I think, is how this localized problem, inflammation on the feet, can actually be a signpost pointing towards much bigger systemic issues happening in the body.
Like a window into their overall health allergies, immune function, hormones, even hidden cancers.
Precisely. It's this complex interplay between what you see locally on the paw and what might be going on systemically.
And that point the source makes about management versus cure, that really hits home. For many of these conditions, it's not a one-and-done fix.
No, it highlights the long-term commitment potentially involved for owners caring for a pet with chronic pododermatitis. This whole journey from seeing maybe just excessive licking to navigating this huge list of possible causes, the diagnostic path, and then potentially lifelong management, it really underlines the depth hidden within what seems like a simple problem.
It certainly does. Well, thanks for joining us for this deep dive into canine and feline pododermatitis, really getting into the weeds with this specific source material.